In the silence of a Zambian night, a persistent buzz fills the air. It's more than just a noise, it's a menace. This is the foreboding hum of the malaria-carrying mosquito, a small but lethal threat.
Malaria bulwere bumo obuyipaya. Alo malaria ya kwali baka mosquito akana kashaka kota ekasumanga kasuma omuntu kamushira obulwere akwata malaria. Koze olonshira ishiba pali ifya malaria nalikwata omwana ichwandi alikweta omwana. So lo omwana oyo alwere tabamutwere wangu hospital. So alisa afwa.
Malaria, a mosquito-borne illness, ravages lives in rural Zambia. Pregnant women and children are its most vulnerable prey. In these villages, mothers have watched hope fade with each rising fever. This scenario repeats it across Central Province, about 700 kilometers from Muchinga Province.
Malaria affects everyone. It does not just affect those that are maybe in the villages. I heard somebody talk about them not having malaria in Lusaka, and they were like, no, us in Lusaka we don't have malaria, so malaria is for you people there, out there. Malaria affects everyone. It doesn't matter where you are. At least it's going to affect you somehow. If you're not sick, you must know somebody who is sick with malaria, or you must be nursing a person who has malaria. And so it affects everyone. And you may have all the knowledge about malaria, but a death can still happen in your home. I'm not speaking about this from without. I'm speaking something that I have experienced myself. Even working as Executive Director for Malaria Partner Zambia with all the information. And the hospital is maybe just like a stone throw away from the home I used to live when I lost my son to malaria, severe malaria.
Like in my family, we did experience sometimes a child or my siblings, they become so sick with high temperature, headaches and all that.
At the time I was sick of malaria, I was sleeping a lot. I never used to eat. I only used to eat food like only soft food.
And for millions across Zambia, there is no safety net here. Malaria is a year-round phenomenon. It fills hospitals and clinics with mothers, fathers and children. In a hospital like this, 4 will die of malaria from 20,000 cases.
Kwena mumushwandi abantu abengi abo abashangwako mukusangwa ku kipatala ile balwala malaria. Abengi kwena babwerera fe bambi kumfwa bambi balafwa kanshi bulwelo bubisana.
Malaria is not merely a health emergency, it's an education and community crisis. Yet in the midst of this struggle, there are those who refuse to let the malaria parasite claim more lives.
Our goal is to reduce the severe cases of malaria and death. Obviously, a person dies when malaria is severe, and then malaria gets severe if treatment is delayed.
When we have a big project, such an important project like Malaria Free Zambia, what we do is we can really expand that, and we can bring all of our technical capacity as well that's in our staff that we've trained and we've developed and they've worked on other projects. We bring all of that to bear onto this project so that the beneficiaries in the communities, those people living in the villages, those women and children, they get the best that Zambia has to offer in terms of preventing and responding to malaria.
So this is where we are trying to bridge the gap. So by training, equipping and deploying these community health workers, so we are allowing the community to access treatment very early, in the early stages of their illness, that is if they have malaria. Many people die in their homes because they cannot access treatment as quickly as possible.
The whole idea of increasing this community health worker footprint is so that we can take health services as close to families as possible. It's part of the Ministry of Health's mission, and through this we find a reduction in deaths, malaria deaths that is, and also improved quality of care for children under 5, pregnant women, and so on.
What this project means to me is an expansion of that approach. And so it's fantastic to see. It's 1.35 million people that are served under this project, 10 districts over 2 provinces. So I think it's a wonderful contribution from Rotary and the partnership. And in the end, it means less severe death and less severe disease due to malaria.
Rotary's groundbreaking programs of scale, called Partners for a Malaria Free Zambia, represents a beacon of hope in the battle against malaria. This initiative, Rotary's first program of scale, is leaving an enduring impact on the health and well-being of communities in Central and Muchinga Provinces.
A number of Rotary clubs, led by the Rotary Club of Federal Way in the United States, recognized the huge danger that malaria posed to Zambia. And they decided to hold hands 3 years ago to put together a project proposal to raise $6 million to invest in the fight against malaria in Zambia. From the viewpoint of the Rotary Foundation, which is our financing institution as Rotary, this qualified as a program of scale, meaning it is one of the biggest single projects that we were funding. The very first, actually, in the Rotary world.
So World Vision has 6 core values, and one of the core values is that we value partnerships. So we do recognize as an organization that we cannot work alone. And because of our value of partnership, we know that we bring quite a lot to the table and are able to join hands with other partners to increase our scale and our reach in order to, in this case, fight malaria. So World Vision has had a wealth of experience in working at community level with community-led initiatives. And in this case, as we look at the disease burden of malaria, we know that World Vision has had a length of experience, over 16 years working in fighting against malaria, working closely with the Ministry of Health. Therefore, with this experience, World Vision has a technical capacity and was open to partnerships because we realized that collectively with other organizations, we can contribute to the National Malaria Initiative.
We are happy as World Vision and also as Malaria Partners Zambia working together in implementing such kind of programs. And it is good that we have implemented the program very well, which has seen us actually to benefit other countries like Mozambique, Congo, and Nigeria, who are actually coming on board on the upcoming project because of the achievement which Zambia has recorded. The funders have seen it well that the program could be scaled to other countries and indeed also in country here to other areas where the program has not been.
Kwena mumushimu mwandi akakabungu ero kaishire kabalile pachipatala ero kwali ukulemba abantu abo angirweko mukwisasambirishiwa kanshi ababantu kwena abalabomba fe buno mumushi kwena ulu bali nsendelemo lukalamba olwakumono kutilati ababantu aba batrendi kuli akakabungwe batwalira ukula kambisha abantu mumushi ukubafunda nokumono kutilati bakonka amafunde yakwikalira mu kuchimfya ubwino obulwele wampepo.
By 2022, the program achieved a significant milestone by training 2,500 dedicated community health workers, CHWs, who have become the frontline warriors in the fight against malaria. These CHWs are not just healthcare providers, they are agents of change, catering to the health needs of 1.25 million Zambians.
Tulembira muri kolamushani di tukolamu ke so twapusha kusanyisha nomba bayi.
Every day on average in Zambia 4 people die of malaria. That's unacceptable. It's a disease that we know it causes it. It's easy to test for, we know how to treat it. So in 2024 no one should be dying of this disease. But it's difficult because again it hits hardest in areas that are often in rural communities. And so to get quality health services delivered in a timely way in those areas is a challenge. And so I think it's really important to expand the community health worker network, as was done under this investment, where you have members that are trusted by the community to test, treat, and track malaria. Testing and treating for malaria is nothing new. What's unique about Zambia is there's tracking of it. And so you have, from the health facility every week, from the community level every month, you have the malaria data, and then that's visualized and decision makers can use it. So not only are you catching infections early and saving lives, you're also able to monitor the malaria situation even down to a very local level.
So what we do is we train community health workers to enter the data that they collect, to all the cases they test, every bit of information that they collect with regards to the testing and treating services that they offer in their communities has to be entered into registers that we give them. So they enter this for every single case that they attend to. And then at the end of each month, all of this data is collated. Amongst them, we select what we call data community health workers who help to put this data together. And as they put the data together, it's checked together with the health facility supervisors. And at the end of it all, they send this data via phones that we give them. So we ensure that they have talk time in their phones. We ensure that the phones are functioning perfectly, and they're able to send this data once each month. On the 4th day of each month, they are sending data for the preceding month. And this data, once it goes into the system, it can be checked at various levels, at the national level, provincial level, district level, and even the health facilities can check this data.
There is actually improvement in the communities as people, access the health services within, their localities. They reduce the time wastage that they move to all these facilities covering long distances. And by so doing, I say that, they're improving their lives, okay? By being productive. They spend more time in their fields, they spend more time in doing things that bring about, development in their households.
The impact extends of community health workers goes beyond malaria. The CHWs receive diversified training, including the diagnosis of respiratory and diarrheal diseases, ensuring a holistic approach to community health care.
We provided these community health workers with enablers. These are a bicycle, then bag, those things that they need for them to operate effectively and efficiently as they undertake their work. So those small things are actually a motivator for these community health workers.
The program has also supported the training and formation of neighborhood health committees in all the 10 districts the program is supporting. The program routinely supported activities aimed at ensuring that data used for decision making and informing policy is accurate and, very importantly, reliable.
Mulifresha kosi kwena inenga paruandi kwena nintemwa sana pantu kwa alifimo shako bati uleta nomba twalila bileko fimo but batu tishamo so nomba twa bafe nomba twa batu pampa mwamano ayengi sana kwa bati ngatwabwerela kulioko tulefu uko twafuma tukayabombe chikankala sana kuchirapo na palifida tubomba.
Since the rollout of the PMFZ project in Muchinga and Central Province, the numbers of severe cases and deaths have plummeted. There are actually more cases being detected since there are more CHWs offering testing services in the communities. School attendance and grades are up. The clinic and hospitals are less congested.
Chinsuma pantu chaliangukako nangubush kumwana lwala kuyoko kuinero na kufipatala takuleba congestion mula ndino kuchiwalepera na mumushumuti.
Kwena chimono ande munapo chakwevo kutilati kwena balotali na beshana makasana pantu infweshingi itashide chitika mumushimu mwandi no kupitira mu bulwele bwa mpepo elona abantu nabeshi baifya kutilati kwena bale isunga bwino nko ichingirira kuli bwino bulwele.
I would like to recommend the Ministry of Health for introduction of the health workers, I think that has helped a lot. If it wasn't for like that, I think we would have experienced so many death rates. It would have increased, but because of that, I think it has reduced. If it may the government may continue using the health workers, I think the issue of malaria, it will not be there. It will be history.
For Ningalanda po, shakwebati ababantu bali yafuilisha sana. Lo futhi ngakubula bena tethi abakuchipatala bakwanishe.
Okay, I've seen that the client flow at the facility has reduced. Before, we had a lot of clients coming to the facility because of malaria, and they were coming with severe malaria, but this time we only have a few clients coming with severe malaria.
So now, providing a community health worker within these communities has really helped bridge that, because when a person is not feeling all right, they have a community health worker very close by. And if they can't even go to the community health worker, they are able to just call the community health worker to their home, and the community health worker is going to test them and treat them if they have malaria.
So I saw how, very pragmatically, very practically, how this project is bringing fullness of life to children. And it was great. In Central Province, I saw this acting group and these dance groups just bring the message of malaria prevention and response to life. And I could see how the community was drawn into this, into the messages, because they saw how easy, the actors made it seem so easy to be able to respond. If you get sick, here's what you can do. It's very simple. And this acting group just made it very approachable. So if you did feel sick, here's what you can do. And here's how easy it is to get tested. And here's how easy just taking a couple tablets can prevent very severe symptoms from malaria and prevent you or your child from dying.
At the peak of the success of the Malaria Free Zambia project, something unexpected happened. The unwelcome arrival of COVID-19, restrictions on movement and the fear of the unknown threatened to derail the progress made against malaria. The very success that seemed within grasp now hung in the balance as the world grappled with this new adversary.
COVID-19, if you look at COVID-19, it really hampered us really to achieve our targets so quickly, because the numbers, were reduced. When we were training, we started with 40 in a classroom, but then that 40 per session was too many people. In the time of COVID, that number was reduced to 30 per session. So already that meant that we could elongate and prolong, achieving the targets that we had set for the program. But we managed to achieve the program very well by training 2,500 community health workers by the end of the second year of implementation.
And the Rotary Foundation held hands with our two partners, World Vision and Melinda and Bill Gates, to put in $2 million each to fund this project.
Partners for Malaria Free Zambia is more than just a program. It's a symphony of collaboration, commitment, and community empowerment. Together, the project is drowning out the hum of malaria with the buzz of progress, paving the way for a healthier malaria-free Zambia.
We're talking about eliminating malaria in 2026. So how are we going to do it? Of course, it's not going to take one intervention to eliminate malaria. It requires a combination of interventions. So we need vector control, we need the prompt treatment, we need preventive measures. If we also take advantage of vaccines, then that is going to help with the elimination of malaria.
The impact of PMFZ in actually integrating community case management in the program is very visible, and I want to explain it from the point of view of the community benefiting when we train these community health workers, they go back to the areas where they stay, and they start actually seeing, screening people from those who come at their houses, and they diagnose them. When they are diagnosed with malaria, then they are treated right in the community. Okay? What does that entail? It entails that people now have more time at their own household to make sure that they are able to do things that bring about a productivity. I think generally this is what it is all about. And when we look at the contribution of this program, it means that we are contributing to actually lowering the burden of the disease. That is another impact of the program. And when we lower the burden, all those resources that were supposed to be channeled towards procurement of drugs, okay? All those resources that were supposed to be channeled towards procurement of medical supplies and the like that are tailored to management of malaria, they are all, rechanneled towards other developmental, areas.
So each community is very different, right? They might be close to each other, but they still have unique needs. And yet what we've been able to do with this project is help make the health staff in those communities, at the clinics or at the health posts, even at the schools and other places, just the real champions. So we've helped really bring their capacity up and helping them be the champions in their own communities, so that the communities themselves, even after the project graduates and moves somewhere else, that capacity to prevent malaria, how to respond to it if it does happen, if somebody contracts malaria, that capacity remains in a strong way. And so those community members are now the champions. They're the ones that take the project into the future and keep malaria at bay here in Zambia and in their communities.
Each of the 2,500 trained community health workers caters to a population of 500 community members. So this translates to 1.25 million Zambians now having access to essential primary health care right within their communities. This was not happening before. Community health workers have detected 1,323,892 malaria cases in the community against, you want to compare, 1,062,555 detected by the health facilities. So we have more than doubled the detection rate.
Kwena mashufya kulekelesha kutashafye kukabungwe kawa Rotary kabili kupitia na ku chiputurwa chabumi mukumono kuchilati vaposa kwa mano muku mona kuchilati vakambisha kona bambi abenga bomba wiwino mulimo wakufunda abantu kuti beshibe ububi ubwava mu bulwele bwa mpepo.
Bu community health worker kutina landa kutila twadiwambire fikunu moko. Ilo Rotary Club yaisa na yena yaisa tuchita empower pakati amayanda pamwesu at least batupela ko lubalu balilwa miendele batupela kwefya kufuala mukati akamfula batupela kwa matocha kubomfya pantu abalwele tabako ateshite wangachita chani benga putukapo kuisa muntu ngaumfo obubi bushi kukuti yaisa batupela na fimbi fya kubomfya mukuichingirira ilo tulechita chani tulemona abalwele beso so bali twafwa sana fye ba Rotary Club ichakutira challenge emilimo yesu kumoneka ukwanguka ero na ifwe nokumfwa bwino inchito yesu pamulando wakutira twamona ko support iyo tulepokera kufuma kuri ba Rotary Club.
Inende ko sereshafya abantu kuti mwe bantu muri bu community health worker mwali babwino kubombera abantu nga pabumi ndeta shana ba government pakuisa support baleta kuri ba NGO weso abaisa mukutwafuirisha ngo mifwire ya Mzambe pantu mu kumisaidi kumyesikona twalefwa sana na malaria nomba ino nshita aweta kuti
koli bakopusana opantu jatwalea kuchipatala nangu nauya kuti wasanga kuli laini kuya kokola nomba mumushi kuimafya apene waya bakupera omuti wasapera omwana baleta shati bale bomba bwino pantu ifintu nafyanguka.
As the sun sets on Zambia, the buzzing is no longer a constant reminder of fear. It becomes a fading sound in the background, defeated by the collective efforts of a community united against malaria.